In this episode, I'm talking to a pediatrician who does in-home newborn and lactation visits. Welcome to the All About Pregnancy and Birth podcast. I'm your host, Dr. Nicole Calloway Rankins, a board-certified OB GYN physician, certified integrative health coach, and creator of the Birth Preparation Course, an online childbirth education class that will leave you feeling knowledgeable, prepared, confident, and empowered going into your birth. Quick note, this podcast is for educational purposes only, and it's not a substitute for medical advice. See the full disclaimer at ncrcoaching.com/disclaimer. Hello, welcome to episode number 27 of the podcast. Thank you for being here. So today on the podcast, I have Dr. Sonal Patel. Dr. Patel is a pediatrician and neonatologist, also the mom of 4 boys. Now, through her personal and professional experience, she noticed holes in the way postpartum care is delivered, and she founded Naya Care Newborn Specialty Clinic. And this is a unique model of in-home care for newborns for that first month of baby's life. She also combines it with having a lactation consultant in her practice. She herself is also trained as a lactation counselor. She has a mental health counselor in her practice as well as a psychiatrist. She is very passionate about bringing improved postpartum care, making it really comprehensive, both for babies and moms, and she does this one mom at a time. Now, I really found the model of care that she provides very interesting. She's going to talk about how she does in-home visits in that first month after birth, and these are 1-hour in-home visits typically, as well as being available by text message if need be. She also talks about what to look for if you're interested in in-home care. We talk about how she helps families transition to their regular pediatrician, and then she shares just lots of great tidbits of advice for moms for things like why you should let go of guilt, why you should take a break, how you should be supported. So you are really going to learn a lot from this episode, just like you learn from every episode. Now, before we get into the episode, I want to remind you, if you are not on my email list, then you should be. I send out a weekly newsletter that contains a dose of information to help you have your very best pregnancy and birth. I always include some inspiring information to help with that so important mental health and wellness piece of pregnancy. And then I also include a helpful tip. It can be something like nutrition, maybe epidurals, and maybe exercise. So I cover lots of different things. I keep the newsletter short and sweet, so it's not terribly long to read. And the newsletter is also the first place where I announce new things like specials on the birth preparation course. And I don't offer those very often. So no spam ever. I don't sell your information. I keep the emails to about once a week, occasionally twice a week if I have something major going on. But if you're not on the list, then you definitely want to be on the list because it's the best way to stay in touch with me. You can join the list by going to ncrcoaching.com/email. That's ncrcoaching.com/email, or you can just go to my website and there's plenty of places to sign up there. All right, so without further ado, let's get into the episode with Dr. Sonal Patel. Hi, Sonal. Thank you so much for being here. I really appreciate it. You have a really interesting story and the way you practice, and I'm sure the listeners are going to learn a lot.
Well, thank you for having me and the opportunity to let your listeners know about it.
Yeah, so how about we start off by having you tell us a little bit about yourself and your work and your family?
Definitely. So my name is Sonal Patel. I am a pediatrician and I did further training in neonatology. I moved to Denver, Colorado in 2009 with my husband and then one son. And I practiced NICU for 7.5 years. And during those time periods, I went and had 3 more kids. Yay
Wow.
me.
So what are the age ranges then?
So my youngest is 4, then
Uh-huh.
there's a 7-year-old, a 9-year-old, and then my oldest is 13.
All right.
They're all boys, so that's always very interesting household that I live in. And yes, I live with 5 boys, and I always say I want to feel like I'm living with 5 girls. So no, that's the part. And what led me to what I'm doing currently is that only my own personal experience with postpartum, seeing NICU moms with postpartum, just led me to believe that there was a better way that we can offer postpartum care in the United States to be more complete and to actually value the fact that the mom just had a baby. And so that's what led me to develop Naya Care Newborn Specialty Clinic that serves the Denver metro area. It is a home-based clinic, and what we essentially do is after a baby is born, routinely what happens is after 1 to 2 days they go to their pediatrician's office.
Right.
And unfortunately in this day and age, those are like 15-20 minute slots. And you can't really get much in it, right? You can't address everything, especially with a new mom who has so many questions.
Correct.
You can't address all of that. And one of the biggest things is lactation and breastfeeding to make sure it's all going well. And so what happens routinely, it's like, okay, mama, you have these issues. Why don't you go to the lactation group? So what happens in the first week is that we're trotting these moms and babies kind of all around town, because usually they'll deliver at the hospital, then they go to their pediatrician's office in this one area, and then they go to a lactation group, most likely in their hospitals. And
Right.
they routinely go there. And for the first week, that's what we're doing with moms to make sure that they establish breastfeeding. And in this day and age, I think we've had such a huge cultural shift. I mean, obviously being a pediatrician and focusing most of my career in infant nutrition, there's an importance of breastfeeding. But if you look at it, the first week is so important to establish it. You know, you just don't get up with the newborn and go. You have to plan
Right.
for
Yes.
it, you know? Like you plan a couple of hours beforehand. You want to make
Right.
sure, like what if the baby gets hungry on the way? Like you have
Yep.
all these stresses
The
on top.
diapers and the extra
Yes.
outfit and yeah.
And what if this happens? What if that happens? A more of a seasoned mom kind of will, I mean, they go through it, and so they kind of know a little bit about it, but these new moms have no idea. And that's what, I mean, even as a seasoned mom with my 4th baby, I just remember I had so much on my plate. I literally, in order to get on time to my physician's appointment, and mind you, I didn't even see the physician that day. I just saw an RN, and that's what really prompted me. I mean, it took me 3 hours to make sure everything was ready. My kids were all settled, you know,
Right.
like all the I's were dotted and T's were crossed. So just looking at it, that led me to all this research, and I realized a lot of European, Japanese, and Australian countries actually have such a high quality of postpartum care in which they will send out either an RN or a midwife that is experienced in lactation and do the home visits in the house.
Right.
I've had a couple of friends who have delivered in Denmark, and they've just said it's such a stark experience with somebody coming to your house daily that they experience versus here, because she had one baby here and one baby there. And she goes, I would take Denmark's system over anything.
Oh,
Because
wow.
it's just more supportive on
Right.
just the postpartum part.
Right.
So it was just like, well, why can't we do that here in the States? Like, why can't not a physician go out with lactation bundled up so it becomes more of a meaningful visit all at once? And there are some programs here like Kaiser. If you're living in a state that is heavy with Kaiser, we do have Kaiser here, but it's a very limited population. They do send out their nurse who is at minimum a lactation educator to the house, and then there's some federally funded programs. However, there's always like a stipulation, like you have to be either low income, or you have to be African American, or you have to have your first baby, and you have to have a teenage mom. And it's like, you know, every mom with every baby is different, and the
Sure.
experience is
Right.
different.
Of course.
So it's just we're just offering it to very subset of women. And it was my 4th. I needed the most help. It was my 4th. So what we do through the home health is I go out, I'm actually lactation I'm a CLE, and I've just really dedicated all my life for breastfeeding. So I
Okay. And
just
what is
have
a CLE? What is?
it's a certified lactation educator.
Okay.
And I didn't, so the actual highest level is an IBCLC. It's an International Board Certified Lactation Counselor. I have so many years of breastfeeding, not only personally, but I actually helped develop a breastfeeding program for the premature babies, which we're on a side note trying to launch it in different NICUs
Right.
around the area, that I didn't want to do an IBCLC, though I had the
Okay.
hours.
Right.
And the only reason was I'm tired of taking a board exam.
Right.
I was like, I'm so tired of it. And I commend all those women who are out there who are MDs that are going through it, because I know the process. But for me personally was, I'm done with that part. Like
Gotcha.
I'm part of the breastfeeding medicine. I get their journals. I rather would spend my times doing that than actually learning something and sitting for the board exam again.
Gotcha. So you have all of the education and training, just not the
Yes.
title.
Yes.
Yeah.
And that's why I just went ahead and got the CLE part of it,
Okay.
because at least like people know that, it's I have some investment in it. And then when they actually work with me, they're like, oh, you know a lot. It's like,
Gotcha.
yes, I know.
Gotcha.
I know a lot.
So you go out and see moms in their home within the first, is it week after birth?
A couple days, actually.
Oh, okay. Okay.
mhm.
Okay.
The first 2 to 3 days after post hospital discharge.
And you see them how many times do you see them?
It depends. So the whole program is for a month, essentially. So in the state of Colorado, they require 2 newborn screens. Some state only required 1 newborn screen. And the newborn screen is a tool that is used to detect any metabolic or genetic diseases that can have preventable interventions that can lessen outcomes. For example, hypothyroidism. You can give them, if you have congenital hypothyroidism, you give them Synthroid, and their neurological symptoms are diminished. So in the state of Colorado, we need to do 2 of those. So I usually go to the 2 to 3 day, and they come in packages. And sometimes the moms just want that, especially the seasoned moms. And sometimes they do that and they're like, oh no, please could you come back for the second week visit as well and conduct that at home, so I don't have to go out again and do my newborn screen at the clinic.
Gotcha. Okay.
And then regardless of if they pick the 1 or 2 visits, every one of my moms has a mandatory phone call at 1 month with myself or the counselor. And we screen for postpartum depression with that. And so that's just mandatory, because I've suffered through it, and I just don't want anybody else going through what I had to go through.
Absolutely.
So, yeah.
Absolutely. And when you go see moms in their home, how long are you there?
I'm there about 60 to 75 minutes, depending upon if it's a completely new mom versus, if it's an experienced mom who just really needs additional here and there help. And it's so rewarding, because now I can actually tailor my just advice to their environment.
Sure.
Like it's like, hey, where do you usually breastfeed? Let's go there.
Gotcha.
And usually the dads are there, and usually there's other support systems that they have in play. Their moms are there. Sometimes their mother-in-laws are there. And you can just tell them advices also to help that mom. So for example, one thing I do teach dads on the side is, so in my culture, infant massage is always incorporated. Like my mom came and did it to my kids,
Okay.
like that's part of our culture.
Right.
And so then I can teach them a couple of things with infant massage that are very simple to do. But now dad has something concrete to do. He's learned the couple of stretches, and that allows mom to be like, then I can be like, hey, mom's going to breastfeed. Then mom, you are going to go away and you're going to take your nap.
Right.
And dad, you're going to do this in this position, and you're going to, so usually also in the first week, we deal a lot with jaundice. And every kid has some degree, every baby has some degree of jaundice. So you can say, well, here's where you get the best sunlight. So, for 5 to 10 minutes with the diaper, expose them. do these infant massages. And so that becomes a really like a concrete thing that dads can do.
Mm-hmm.
And that's, with the mentality of men, they want to help. Dads are so want to help, but they just don't know how sometimes.
Right.
And so to give them something concrete to do rather than, just changing the diaper.
Right.
Like something that they feel they're contributing to.
Gotcha.
It's really helpful. And then like there's certain times too, with you remember when you're having a baby, you just want everything in control, and especially type A people like us, we just want everything like for us to be in control.
Right.
So then you can tell the moms and be like, no, listen, grandma's here, so let her do this. And grandma's sitting in the back and saying, nodding her head. She's like, yes, please tell her to give up some of this stuff for me.
Right. Right.
And so it just becomes it becomes a really neat way to help the whole family out. And the underlying my message always is, you support the moms, everything falls into place. But also with moms, to allow them to let go a little, and not to be like, no, you can take that nap, or you can let grandma do the dishes and don't feel guilty about it. Like it's okay.
Right.
You can pay them back later.
Yeah.
Like 4 or 6 months later, give them a nice spa, give them a good dinner,
But for that moment, let them help you.
Yes. Because they're there for that.
Sure.
Because sometimes, like I think I've been victim of this too. Like I didn't let my mom or my mother-in-law do the things. I wish I would have been more upfront to be like, no, I can't do this. Like, this is too much for me, as opposed to being exhausted at the end of the day all the time.
Right. Trying to do everything.
Yeah.
So do you do any like blood work or blood tests that need to be done if needed in the home?
Yes, I do. So mostly the most amount usually is for bilirubin. And so you just do a heel stick for that.
Okay.
And I have a partnership with a local lab here where we can get the results, the same day results.
Oh, wow. Okay.
Yeah. And then the other one is just the newborn screen, which is also a heel stick.
Okay.
So majority of these ones are just heel sticks that you have to do. And those are pretty easy.
Okay. And then of course, I'm guessing you have a scale or something, because I know weight is an issue. Yeah.
Yes. Yes. It's literally the whole clinic. So I have the scale. I have, obviously the stethoscope. I have the otoscope, ophthalmoscope. Everything just comes with me.
Gotcha.
So
okay.
It's very portable. So it's like you can just do the newborn exam.
Everything there.
Yes. And then my lens is coming from an ICU setting too. And there's actually a really neat thing in Colorado, I think. And honestly, this is I don't know about other states just because I haven't looked into it. But I know in Colorado, they passed a law that every baby within 24 hours needs to be screened from a congenital heart disease perspective. So that goes on their birth certificate. So any of those major cardiac diseases that would have in the past put babies back in the hospital in cardiac shock are now actually screened before the baby can even leave. And if they fail the screen, then they get an echo, right? So one of the biggest things that we all worried about is now in the state of Colorado, it's been alleviated. So in majority of the cases, what you walk into is a healthy newborn who needs help with breastfeeding, and a mom who just needs the support.
Gotcha. Okay. Yeah. So you said you yourself do lactation, and you have a mental health person. Who else is on your team? Do you have other folks that work with you?
Yes. So I contract with other lactation people in the community. So why reinvent the wheel when there's some really good ones in the community as well?
Right.
So sometimes when I can't do, or sometimes new moms also, there's an option to add just a lactation person visit, exclusively just for lactation. So and if I get too busy, it's like, hey, could you please do that visit exclusively? So that's all they focus on is lactation.
Right. Okay.
And then the other person, we haven't had to use her yet, which is awesome. And I think the beauty is why we haven't had to use her is our psychiatrist.
Okay.
And it's because
and I want to stop for a minute, everybody. Look, she just said she's excited that she doesn't have to use a medical professional.
Yes.
Like we're not always trying to, push medicine and things like, we're trying not to in some cases. So you're saying you don't have to use the psychiatrist very often.
Yeah, no, we actually haven't had to use her at all so far. And
Right.
what we've found is, and this is what research has shown, is that if you can support, so we offer like, I'm one of those, is like, I'm not just going to do the one visit. I'm going to follow you until I make sure that you're okay. Because all my
Sure.
moms, even I'm texting, and they're like, babies are 4 months and they're seeing their own pediatrician. And I just find, and again, research support is that if you can support the moms in a good way, and a good way meaning with addressing their needs and making
Mm-hmm.
sure that they're comfortable with all their needs, then you actually are preventing the anxiety and the blues, or you're actually finding it out earlier. You're like, we're at the 2-week marks, your blues are there. You're still crying a lot. What's going on? And then,
Right.
and then the 3-week mark, they start to like, I really don't think that you're doing as well as you're saying. And then they kind of just open up and they're
Right.
like, yeah, I
Right.
just don't feel this. And, at the 1 month, especially, like, I've had a lot of moms being like, all I do is breastfeed. All I feel like is like, wow. And you're just like, yeah. you know? And then you give them the permission to go and get their nails done, or you give them
Right.
the permission to be like, and without the baby.
Right.
That's the biggest thing, because then you have to realize, you've been taking care of this human for now 11 months. Like, 11, think about it. Like, you have to
That's
carry
true.
the pregnancy, right?
Right. Right.
And
Right.
you have been so invested in it. And so it's okay for you to go for 30 minutes to an hour to go get your nails done. And giving them the permission to do that it's been like, oh, I can? Yes, you can go to Target and room.
Gotcha. So it sounds like you have a really like individualized approach, and just it's really all about support
Yeah. Yep.
in that crucial period. Because I mean, I have to be honest. Obstetricians certainly don't do it right now. We should, but I'm ashamed to say that we don't. Right now, for the most part, people see their OB doctor not until 6 weeks later.
Right. But that's how the system is set,
Yeah.
right? That's how, and like, we had just this year, we had, and again, the pediatricians are so taxed also, right?
Right.
Because now they're like, now AEP and ACOG, I believe, just came out and said, oh, we should really be screening, the dads or the significant others. And you're just like, well, how can I do this in 15, 20 minutes? Like, that's
Right.
ridiculous. Like,
Right.
you're asking so much of me.
Right.
So, yeah, our system does not help support what we need to do the best at.
Exactly. Yeah. Yeah. So if a family is thinking about if they want an in-home pediatrician, where can they even go to look for one?
So actually, just Google it. You'll be surprised.
And
You really will be surprised in your state how many pediatricians or people are out there doing it.
so it's more common than we realize, you think?
I think there is a subset of people that are there. I know a couple. I know a doctor in Ohio that does it
Okay.
as well. And the more I am doing it, the more I get. I'm getting exposed in it. So there's another. I believe she's a family medicine doctor
Uh-huh.
that is going to be starting her practice in Arizona. And she's like, I totally want to incorporate this, because as a family medicine, I've honed it into this aspect of it. And so I get people, not a lot. Once in a while, every 1 month or 2 months, I'll have a physician calling me. It's like, hey, how are you doing this? And in
Gotcha.
the physician Facebook's things too, when people
Uh-huh.
say that, and people are like, oh, this doctor, meaning me, is doing this in Colorado already.
Gotcha. I'm in the Richmond, Virginia area, and we have someone who does it around here. I was surprised. It's not something that I knew existed. So
Yeah.
definitely a great option. So if women are thinking about this, what are 3 things that you recommend they should ask about or look for when they're considering having an in-home pediatrician visit for that first week or so?
Right. First of all, ask what the visit actually will look like. How long will it take? So if the pediatrician says it's going to be like a 30-minute visit, I know from experience that no visit lasts 30 minutes when you're in the house.
So you're saying at least an hour, you think, around an hour. Yeah.
Yes. I think if that pediatrician is providing that service, then definitely make sure it's a pediatrician, an MD. The reason I say that is just because I don't know what all the laws are around the different states, and I don't know the capacity of other people's training.
Gotcha.
But to have a pediatrician, then I mean, that's the best advice because that's the lens that I'm looking at,
Sure.
So, and lactation is important because unfortunately we're at a point in our time where everything's latched on to breastfeeding, right?
Mm-hmm.
If you can breastfeed, you're a successful mom. If you can't, then you're a failure. And I'm like, that is just absurd.
It is
But
absurd.
yeah, but that's what we're living in. So you have actually built-in lactation, or they can help you for the price get a lactation person that they trust, because some of those lactations are very diverse. And just like how you interview a pediatrician, just see if you ask the questions about, what are your thoughts on X, Y, and Z? Meaning, what are your thoughts on breastfeeding? What are your thoughts on co-sleeping? What are your thoughts on, all of that stuff, and see if those answers fit what you are feeling, right?
Okay.
With the whole co-sleeping thing, I always say that it's so disservice to the moms to be like, okay, you can't fall asleep, right? It's like, come on, think about it.
Right.
Why is it the mom's responsibility for everything?
Right.
That, like the dad, like just tell somebody, because I had a C-section and I had my second one, I had such terrible grade 3s and 4s, and oh my God, it was it was a uterine infection and all that big mess that comes along with it. And I would sideline nurse because that was the most comfortable to me. Well, sideline nursing is literally on a bed.
Right.
And guess what? I would fall asleep.
Right.
But it wasn't on me to make sure my baby was okay. I would tell my husband, or I would tell my mom that was there. It's like, hey, I'm going to go lie down and breastfeed. Could you please come check on me?
Gotcha. Right.
Because it's like, it's like, why do I have to do everything? Like, why do I have to make sure that I'm sidelining? And the other thing I would do, especially during the daytime, would be put an alarm on my phone just to make sure I wake up, or then I can call somebody to help me. But I'm suffering here. I always say a C-section is, it's abdominal surgery with a baby attached. So it would be so hard for me to keep coming up and down from that bed. So to use my resources that are around me, especially the dad, to be like, hey, dude, I'm going to sideline. I'm probably going to fall asleep because I'm tired and my body's recovering.
Right.
If I do fall asleep, could you please move the baby for me?
Yeah, that makes a lot of sense. I haven't even thought about that. And I think it's great that you're like, you don't want to like shame women or scare women. You want to give them factual information and then practical ways that they can address things.
Yes. And I think that's what it is. And then you kind of, this whole idea of bed sharing and co-sleeping, you kind of eliminate it, because as a pediatrician, we know that leads to deaths. And like, as an ICU doctor, I've seen the back end of it, right? So you don't want anybody to be in that position, but you have to understand the reality of when a mom goes. I think maybe that's why I was blessed with 4 different types of deliveries, because I really saw 4 different, because I saw it, like I saw what a C-section recovery looks like. I saw what a grade 3 and a 4 with uterine infection looks like. I saw what a natural delivery looked like, like I saw all the different types of it.
Right.
And it's like, well, why is it always on me? Like, I carried this baby.
Right.
And these people are around me trying to support me and help me.
Exactly.
So, for example, in my culture in India, there's some parts of the village where a woman doesn't get out of bed for 11 days. And what happens, the baby's brought to her to feed, and then the baby's taken away. And all the household chores and everything is done by the women around her and that kind of support. So it's all she has to focus on is, I'm going to recover because I just had a baby.
Right.
So it's that kind of approach.
Yeah.
It's that kind, like, you can't just put everything on us and then be like shocked that we have postpartum depression or anxiety or anger or our relationship with our husbands or our significant others are falling apart. It's like, let's kind of really use the tools that we have.
Exactly. So, and look, we got the co-sleeping thing got me distracted from the question. Yeah. So the 3 asking about, you said making sure they have lactation support, making sure it's a nutrition, and the length of the visit. So those were the 3 things that you think for sure that they should ask. Okay. So then once they're seen in the home, how do you transition families to ongoing pediatric care?
So again, this is from the ICU lens. So we always used to have our babies in the NICU. And then when they left, we would tell the pediatrician, hey, this is what's going on. This is how the baby did, and all sorts of stuff like that. And so that's how I view it. I just view it as an extension of hospital care, because most pediatrician practices now, they don't actually see their babies in the hospital anymore.
Right.
It's usually the newborn nursery or the NICU doctors seeing it. So for a month, the care comes to me, and then it's an easy transition to the pediatricians. And at the end of it, I tell the pediatricians, hey, everything was fine, or hey, we need there's this that just please be aware of.
Okay. So you're with them, and maybe I missed that. So you're with them for that whole first month. You're in touch and texting and available and all that stuff. Okay. All right. That's awesome. So can patients expect that their insurance will pay for this type of service, or should they expect that they're going to have to pay for it out of pocket?
I actually am investigating that answer right now, and I don't know. For me personally, it's a fee for service payment.
Oh, okay.
And the way that I do it is that I know there's a lot of lactation people here that do private practice, and people pay out of pocket for them. So I just see what their charges are and add about $30 to $50 more to that. So in this way, it's like, well, you're getting a medical doctor and lactation for X amount.
Gotcha.
Yes.
Okay. So right now, and insurance has all these tricky things. And you guys, it's hard on our side, especially when you're doing these different or unique models to make it work with insurance. So you may have to pay out of pocket. But this is another great thing that I think you can ask for I'm all about asking for what you need. So like in your baby registry, if you want to ask for, can I get a little bit of a donation towards having a postpartum doula or a postpartum, pediatrician come to my house. Like, yes, the clothes and all those things are great, but just think about asking for some different sort of services. This would be a great gift for somebody to give you for sure.
Yes, definitely.
Yeah. So what do you feel like is the most rewarding part of your work?
Just really going to the homes and people actually welcoming me with open arms. And it's just amazing, and helping that family out. So it's one of my stipulations is after 2 weeks, the mom and the significant other have to go on a coffee date. So it's like, well, it's just because you start that thinking, right? It's just like, and I don't ever say dinner or lunch, because it just seems very overwhelming. And then you never know, like, your baby's hungry, your boobs get big again, like you can't enjoy certain. But a coffee date is 15 to 30 minutes, right? And to step outside and enjoy that, and actually allowing and giving permission to people to do that, and seeing the reward behind it, and be like, oh, Dr. Patel, we really enjoyed that. Thank you so much. Or I just feel like a brand new person, and knowing that, you helped that person out. So absolutely. I guess at the end of the day, you're just a doctor.
But the thing is, here you're kind of redefining though what a doctor does. I mean, you're obviously like more than just the medical piece. You're looking at how the connection between mom and baby is so important, and how as a pediatrician and a NICU doctor, you're playing a role in making that whole family healthy, actually. So it's just a really, refreshing way to look at care. And it's great that you figured out a way to do that.
I think we all strive for that, don't we? Like we
you hope so.
Preventive. Yeah.
You hope so. Yeah, for sure. Absolutely. We want to be able to take that more holistic approach, and it's more than just like checking weight, or like you said, when you went to that fourth visit and the nurse came and just like put your baby on the scale and, bye, see you later kind of thing. We've kind of been backed into that model, but it doesn't have to be that way. Yeah. So what would you then say is the most frustrating part of what you do?
That it's not more common. Like, I just want every mom to have this. I think they all deserve it.
Right. Yeah. I'm sure. Yeah, absolutely. And then if you had to pick, like, what are you the most passionate about when it comes to caring for women and children? And that may be hard for you to answer about one single thing, but is there any particular issue that really, really gets you going when you care for women and children? Yeah.
I think postpartum depression is just because I've suffered through it, and I'm a pediatrician, and I asked my pediatrician for help, and they weren't able to help me. And And the first time I suffered, it was with my second baby, I suffered from it. And I just believe depression is just a misnomer. I think it's a broader subject than that, because I didn't even realize I was depressed. But in my mind, I was mentally checking things off to be like, oh, I did this for my son, and I did this for my son, I did this for my family. But I wasn't connecting with my world. So if you were an outsider who really didn't know me, you couldn't tell me I was depressed.
Right.
And then the second one, I had a lot of anxiety, and I didn't realize that was also part of that umbrella.
Right.
So I think postpartum depression, when you add the word depression there, it just sounds like that's all you should have, and some people I've never had a depressive mood symptoms before at all. And I don't know what depression feels like or looks like, but here's are two incidences where one was probably more of a depressive mood, and I just didn't realize that not connecting to my world was not a big deal, and the anxiety part of it, and that's part of it too. So that gets me going, and I think that's the reason that looking at the research and saying that, if you provide the support and this, it can prevent this. It can have a healthier transition. The fourth trimester, as you know, there's so much data out there about the hormones and stuff like that. So we can ease that transition. It doesn't have to be so black and white.
Yeah, absolutely. And then you talked about it a little bit already, but how have your personal experiences as a mom influenced your work as a pediatrician? I know I talk about how, as an OB, my first daughter was 8 weeks premature. She had duodenal atresia and was in the NICU for a month. So I went through all that. And of course, that colors how I am as an obstetrician now, having a preterm baby. How has your experience as a mom influenced your work?
One, breastfeeding does not define you as a mom. I've had 4 different experiences. My first one was an absolute failure. I'm going to tell you that. And I'm a pediatrician.
Right.
The other 2 to 3, it was my fourth one. I realized my body just gives up at 9 to 10 months because my kids are eating more. They have transitioned early to more table foods. And I mean, I wanted to make that magical 1 year that everybody talks about.
Right.
And I remember what I had to do there. But then when I reflected back, it was like, wait a minute. They were getting enough milk. I just didn't realize it.
Gotcha.
And then also with breastfeeding, it's some women are overproducers, some women produce right amount, and some women are underproducers. And we just have to kind of support everyone's journey and not like chastise them if they want to supplement. And that's what it is. It's supplementation. So let's kind of get away from everybody. I'm so happy that everybody approaches breastfeeding, but some women really struggle with it. So let's back off when they start struggling, and it's okay. Like I've had a mixture of women myself. One woman I'm working with now, she doesn't breastfeed. She just exclusively pumps because her baby, despite all the lactation interventions that we've done, still bites her. And her nipples are raw to the bone.
Right.
Like, really? That's what the enjoyment we want from women to have breastfeeding? So now it's like, okay, well, I will nurse her when she's happy. So I enjoy that bonding part of it. And then I can pump. And, at the end of the day, you're getting breast milk in the baby.
Yeah.
So it's totally okay. So, and that's like my biggest thing right now.
Gotcha. So if you had to pick like your one favorite piece of advice that you would give to expectant parents, what would that be?
There's 100 ways of doing something and of parenting. Choose the way that's best. Keep your babies healthy, safe, and at the end of the day, that's what it matters.
Oh, that's perfect advice. I really like that. There's no like one right way to do things. You got to figure out what works best for you. And that seems to go through your whole approach. It's obvious that you take a very personalized and individualized approach, and you're very passionate about what you do, for sure.
Well, thank you. I mean, I think it's just my experiences. I mean, dealing with it, and it's just, you just see it. You just see if you can just allow women to have the permission of being like, yeah, this kind of sucks.
Okay, I need everybody to hear that, because as a mother, I guarantee you will have a moment where it is not like roses and flowers, where you're just like, right in this moment, this sucks. And that does not mean
Yes.
you're a bad mother. It
No.
doesn't mean you're, unhappy, but it's just that permission to experience that and know that that is okay. That's a big deal.
Yes. Like, it's just, and give you permission to be like, I want to go get my nails done. And here's the
Right.
baby, and I'm
Right.
leaving.
Right.
Like, just leave. Just
Yes.
leave the situation.
Yes, absolutely, for sure.
So,
So where can people find you if they happen to be in your area and they're more interested in your services, or are you on social media or anything like that?
yes. So my website is NayaCare. It's NayaCare.org. And I'm on Facebook at Naya Care Colorado, and then on Instagram, Naya Care. And I think my Instagram account it's fun for me. It's because I highlight pregnancy and postpartum stories in their rawest forms, and these women have allowed me to publish their stories, and I really enjoy that one. And then, yeah.
Awesome. Well, I will link to those in the show notes, guys. So be sure to look out for those. Sonal, I really appreciate you being here and giving all this great information. It was a really fun conversation.
Thank you so much for having me. I did enjoy it myself too.
Yeah. Okay. Right. I'll talk to you later.
Okay.
Okay. All right. Bye-bye. All right. So again, wasn't that a great episode packed with tons of useful information on a model of care that I think is really interesting and helpful, and I hope does start to catch on for sure in the United States. Now, after every episode, I do something called Nicole's Notes, where I take my 2 or 3 top takeaways from the episode and tell you what I thought. Okay, so here we go for Nicole's notes for this episode. Number 1, Sonal talked about releasing control and not being superwoman postpartum. There's a little bit of pressure, I think, in our society. You're supposed to do all the things and be all the things and take care of everything. And really, you just need to let people help you postpartum. That postpartum support is so important, both for your physical healing and your mental healing. So do not feel like you have to do everything and be superwoman postpartum. Let people help you. Number 2, I liked how she talked about it should not just be your responsibility to take care of the baby. Everything doesn't have to be on you. And that example that she gave of co-sleeping and telling your partner or your mom or somebody, hey, come check on me. I'm breastfeeding. If I fall asleep, make sure the baby's okay. Like, it doesn't have to be just your responsibility to care for the baby. Get other people involved. And again, that goes back to that postpartum support. Now, I was also talking about support in terms of things like, washing clothes or cooking or grocery shopping, so you can focus on the things that you want to do. But also don't be afraid to ask for help with the baby too if you need to. I also liked, incidentally, with the co-sleeping that she talked about how she meets women where they are. We know from evidence that co-sleeping does increase the risk of death for babies. And sadly, unfortunately, on the medical side, we have seen those horror stories where women have fallen asleep and had that awful incident happening of a baby passing away. However, she understands the realities of it and that sometimes that it just happens. So I like how she talked about meeting women where they are as well, just as an aside. And then the final thing that she talked about was how taking a break from your baby is okay. And maybe not just okay, but actually healthy and needed in order to help you feel better and just kind of get back to yourself a bit more with this new normal of having a newborn. I loved her idea of a coffee date. I feel like lunch or dinner can feel like more of a big production. It's going to be an hour, maybe 2 hours, but like a coffee date where you go and grab a cup of coffee, or a dessert date where you just go and grab some dessert. That doesn't have to be long. It's not quite as involved. You could even take the baby if you can't get a break from the baby, but just even getting out of the house and getting some fresh air can be very helpful. All right, so that's it for this episode of the podcast. Be sure to subscribe to the All About Pregnancy and Birth podcast in iTunes or wherever you listen to podcasts. And I would most certainly appreciate it if you leave a review in iTunes. It helps the podcast to grow by helping other women find the show, and I often give shout outs on the podcast to people who leave reviews. So please, I'd really appreciate that review in iTunes. Now, next week, I am going to do an overview of pain management options on the podcast. All of the pain management options that are available to you in labor, from non-medication options to IV pain medications to nitrous oxide to epidurals. I'm going to talk about the risk, the benefits, the pros, the cons of each of those methods. So come on back next week. And until then, I wish you a healthy and happy pregnancy and birth. Today's episode is brought to you by Women's Wellness Coaching by Dr. Nicole Calloway Rankins. Head to ncrcoaching.com to check out my free 1-hour mini course on how to make your birth plan, as well as my comprehensive online childbirth education class, the Birth Preparation Course. With over 8 hours of content and a private course community, the Birth Preparation Course will leave you knowledgeable, prepared, confident, and empowered going into your birth. Head to ncrcoaching.com to learn more.